Sorry about that. I was still muted. I have right up on 1 o'clock your time, so we will go ahead and get started. Just a reminder, thank you all for being here. Please go ahead and put your name and your organization in the chat as you are able. I will send a copy of the chat and a video of the meeting, which I started right at 12:59 to everyone in the follow-up email following the meeting. So we will go ahead and get started. I'm going to remove this screen share really quickly. All right. For those of you who are joining us for the first time, thank you so much for being here. I just want to provide a really quick update. The purpose of becoming a HEARTSafe community is to reduce death and disability from sudden cardiac arrest in Porter County. The Citizen CPR Foundation provides us with 6 community-based element strategies and 13 HEARTSafe community elements to work on to achieve HEARTSafe community status. So during our first meeting, we discussed what sudden cardiac arrest is, who can be affected, and that's everyone here in Porter County, regardless of age or any other factors, and how we can work together to improve sudden cardiac arrest outcomes in our county. We discussed becoming a HEARTSafe community and what that involves. We worked together on our initial HEARTSafe community assessment, and we assigned some homework for between meetings. So I really appreciate everybody who took the time to get in there and engage and fill that information out. A recording of our first meeting, along with many of the other resources and supporting documents, can be found in the meeting number 1 follow-up. And I've sent that out a few times as a reminder for this meeting as well. And I don't know if you're familiar with Google, but hopefully you all have your own Google Drive. So once you interact with those, it saves it into the drive. And you can, if you want to, create your own workspace and drag it all together. Please remember, if there's ever anything that you cannot find, a link that you can't find, information that you know was sent out, or even any information that you need that maybe we haven't exchanged, always reach out to me and we will get you what you need. So before we transition from recap of meeting number 1 to meeting number 2, does anybody have any questions or anything else that they would like to say before we get started? All right, hearing none, we will jump into today's meeting. For today's meeting, we are going to do strategic planning. Before we can begin to make a strategic plan for becoming a HEARTSafe community in our county, we need to establish a mission and a vision for the HEARTSafe Porter County initiative. And to help us to remind us of the why for reducing death and disability from sudden cardiac arrest here in Porter County, we've asked a few of our community team members to share some personal or professional experiences that they've had. And I'm going to first turn it over to the Valparaiso Y, Wendy, or whomever you guys have speaking today.
Hi, I'm Elise. I'm our wellness director. I let Wendy know that I could speak a little bit about our experience at the Y and my personal experience with assisting with sudden cardiac arrest. This has been a few years ago now for my personal story, but we did have a well-known Y member. He would come every day, shoot hoops in the gym, go to yoga class, walk the track. You know, we all knew him personally just from him being here so often. And he was playing basketball in the gym, and his heart stopped while he was shooting hoops. And just the response first from the community members that he was playing basketball with, that they knew to immediately report to staff that he had lost consciousness, that he had collapsed, that activated our emergency system within the YMCA. We immediately called the Valpo Fire Department, and they were so quick to respond. We have an AED that we bring to the location of in the building of any medical emergency, that we were able to immediately start CPR, get the AED out. We had staff that knew what to do, and we actually did deliver a shock to this member. The fire department responded so quickly and were so helpful that we had a successful story in this case. And his wife said he's not allowed to play basketball anymore, but we do still see this member in yoga class. And every Christmas he gives me an Applebee's gift card. So we were just really happy that not only our Y staff are trained to respond, but even that the members in the building know that we're trained and know how to get us and get help right away.
Thank you, Elise. Thank you for sharing. And that's exactly what we're trying to do is, of course, make sure that facilities that have a large amount of population, are trained and have a response just like the Y does, with an AED and a plan for calling emergency responders. And also that, as Elise said, our citizens are able and trained and willing to respond in the appropriate way too. So thank you. And then Brianna from the Portage YMCA.
All right, let's see. Sorry, my video's off because I'm eating lunch in between meetings, so please forgive me. So we've had multiple experiences with cardiac arrest here at the Y. Some have ended poorly and some we have success stories. So today I'm going to share a success story for you. Back in 2021, we had a member who was walking on our indoor track. He decided he wanted to take charge of his health and that he was going to get healthy. So he was power walking on our track. He told us that his favorite thing to do was to walk as fast as he could for as long as he could, and then he would slow down and take a break. And unfortunately, he did go into cardiac arrest and fell on our track. And we had multiple basketball players who were teenagers who alerted us that there was an issue. So the teens really, I mean, are the heroes in this story. And myself and another staff member were able to get to him. We did 4 rounds of CPR and 1 AED shock, and he did come to. We were very fortunate that the fire department was having a training literally around the corner, and it took them 2.5 minutes to get here. So it turned out that he had a full blockage, and he went into surgery. And afterwards, he went under months of physical therapy because we broke quite a few ribs. But we joke with his wife and him that, the alternative to broken ribs is not as great as it is here. So he made it through physical therapy, and him and his wife still attend our YMCA today. And we celebrate his new birthday every year with him.
Thank you, Brianna. Thank you for that success story, and Elise as well. And so this is about helping, like we said, all of our locations, anywhere that citizens may be out in the community, to be able to know how to respond in the same way. So we appreciate you guys very much for sharing today. Once we have our strategic planning meeting today and we establish those activities to work toward our community element goals, we will actually be breaking into work groups. And we will begin meeting as work groups more regularly, but we will start in January of 2026 having in-person check-in meetings where we will also conduct those reassessments, community reassessments. For each of those, we would like to begin with a story local to our area to kind of get us in the mindset of, the why that we're doing what we're doing. So if any of you have any stories that you would be willing to share, or of someone who may, if you could please just reach out and give that information, then we can start planning for those upcoming meetings. Like I said, for those in-person meetings beginning in 2026. Okay, so now I am going to turn off my video and start sharing another screen. We're going to go on to that HEARTSafe community elements and goal settings document. And we're going to start with that mission and vision tab. And does anybody have any questions before we do that? If you guys have any questions or want to say anything at any time during any of this, please just go off mute and pipe in and contribute anything. So just want to make sure nobody gets missed in the chat or anything like that. If you do put questions in the chat, we'll get to them, eventually, and read through and make sure we answer them, but please don't be shy. So I am going to drag the screen over here real quick. Maybe. Thank you for bearing with me. I learned new tricks, apparently not very well today. Okay, can everybody see that? Perfect. Okay. Sorry about that. This should not have taken me that long. Okay. So like I said, we are going to go ahead and start with the mission and vision. So in order to make a strategic plan, we have to know who we are, what we're doing, where we're doing it at, how we're doing it, and why. So the who, what, where, how, and why. And those can be done either just in one big mission statement or within a mission and vision statement to identify all of those things. So we started out with thoughts, and we had someone who contributed the following statement here that's at the very top under this. Porter County is dedicated to becoming a heart-safe community by expanding CPR training, increasing access to AEDs, and fostering strong partnerships between residents, first responders, and healthcare providers. Our mission is to equip the community with the tools and confidence to save lives and improve survival from sudden cardiac arrest. So we had a couple comments after that contribution. Thank you, everyone, for adding community organizations to the partnerships. And then also changing the tools and confidence to be tools, education, and to be resources, education, and confidence instead of tools and confidence. And then there was another contribution that kind of switched around the mission statement. The mission of HeartSafe Porter County is to save lives, improve survival rates, and decrease disability rates from sudden cardiac arrest through expanded CPR training, increased AED access, and strong community partnerships between residents, first responders, healthcare providers, and community organizations. So this is highlighted because this one takes into account the community organizations, but when written like this, it takes this portion out. So we're looking for any feedback anybody has on a mission statement. Does anybody have any comments on that? How do we feel about the last one that was contributed? Does that cover everything? Are we still missing those pieces about education, or does it cover it in the expanded CPR training, increased AED access, and then our strong community partnerships?
Could you possibly add in there promote prevention?
Yep. So here, Teresa, is this where you're talking about after increased AED access, expanded prevention promotion, or here in the to save lives, promote prevention
Yeah, maybe right there.
there? I like that. What's everybody else think?
I like that one that starts with the mission of HeartSafe Porter County. It just seems more direct and to the point, and still seems to cover pretty much everything that we're looking to include.
Okay. Thank you, Elise. What does everybody else think? Are we missing anything? I highlighted this only because this part just wasn't down there, but I do think it's covered by saying the activities that we're going to do, but we want everybody's.
One thing, we have a big community visitors and tourism and stuff like that in this area. And it talks about residents, but it doesn't say visitors or some terminology like that.
Okay. Thank you, Dale. So including the visitors in our partnership. See, the mission of HeartSafe Porter County is to save lives, promote prevention, improve survival rates. Do we want to say between residents, visitors, first responders, healthcare providers, and community organizations? Is that what you were thinking?
Yeah, I'm trying to, I can't see where I was, like this thing keeps popping up. Sorry. The chat keeps popping up in the way.
Am I doing it?
Yeah. No, it's just, um, does it say, is that increased awareness? I got increased A, and then
Oh, I'm sorry.
I can't
Increased, I
see the
think it's
whole comment.
AED access.
Okay. The point I was trying to make is that we have some type of signage, things like that, that people in the area know where to find things, and what to, how to, get help if needed. That was my only
Right.
comment.
Perfect. Yeah, absolutely. And I want to make sure, I mean, I think it's HeartSafe Porter County is to save lives. It does talk about partnerships between residents.
And maybe
Is
it's not,
that what
yeah, maybe that's not appropriate for this particular statement, but I just want to, make sure we
that's
are cognizant of the people that visit.
absolutely. Thank you.
Maybe a visitor right after residence, something simple like that.
Yeah, absolutely. What do you guys?
Gary, I don't know how long you want this to be, but you could have it say something like partnerships between those who live, work, play, and visit Porter County with first responders, healthcare providers, and community organizations. That's a little bit long, but it does cover all of the things.
So not to jump ahead, but let's jump down to this draft vision statement somebody provided, because I'm wondering if this is going to take care of it. That just occurred to me. Thank you, Allie, everyone. Porter County envisions a future where sudden cardiac arrest is met with immediate effective action from a prepared community by building widespread awareness, ensuring AEDs are easily accessible in public spaces, and providing CPR training for all ages. We strive to create a county where every resident and visitor has the best chance of survival. Together, we aim to make Porter County a model heart-safe community where lives are saved through knowledge, readiness, and teamwork. Does that cover what we were hoping for when we put the two together?
That works for me.
Okay. Chuck, what do you think?
Yeah, I think that covers it.
Okay. Allie, what do you think?
Oh, great.
Okay. Does everybody like that vision statement as far as what we would envision? Sorry, I didn't mean to jump ahead, but I was kind of thinking that might help us. Think we're good? I got a thumbs up from Matt. Sorry, I go back and forth because I can't see this when I'm sharing my screen. Okay. Perfect. All right, we'll go with that. Please let me know if you have anything different that you want added, subtracted, anything like that. Okay, so we're going to bounce right to element number 1. So when we get into these elements, I will really quick just read the element, read the goal that's established by the Citizen CPR Foundation, and then we have had people contribute activities toward those goals. So we're looking for participation here. And so let us know if you think an activity should be added, if you think something should be adjusted, taken away. We've also had some people who have volunteered to lead work groups and to be in work groups. What we would really like is for everyone to be a part of at least one work group. And please, if there are people who aren't on the call that you think belong in a work group, let us know that as well. We will talk to them, get them on board. And it may be a case as well that somebody who either is or isn't here, if you get missed, we'll get you plugged into a work group. But please speak up and contribute so you can get to be where you want to be and where you'll make the most impact. So HeartSafe community element number 1 is to establish a high performance lead agency and community team. So we established at the last meeting that the health department has agreed to be the lead agency. The Valparaiso Fire Department is working with us as our assistant lead agency, and we all make up the community team. Everybody who's able to be here, those who weren't able to be here today, Anybody that we add to the community team from here on, but everybody that's working in these work groups toward our strategic plan and toward the HeartSafe status. So additional activities, because if you will remember, without activities toward each of the elements, we aren't at a 5 for the goal yet. So in order to achieve a 5 for this goal, we have to have activities to work toward the goals for each of the elements assigned, which is exactly what we're doing today, and work groups assigned with people designated to lead them. So at the end of our meeting today, if we did a reassessment, we should be able to come up with a 5 for this element. So with those additional activities of establishing activities, assigning work groups and designating work group leads, and then establishing a method for work group follow-up, and that will be those quarterly in-person meetings that we kind of discussed a little bit, that will have the virtual option. Does anybody have any other additional activities that they would like to recommend for this element? Anything we're missing that we need to add here? All right, I don't hear anything. We will go ahead and move on to element number 2. So HeartSafe community element number 2 is to use data to drive regional strategies and localized tactics. So the goal here, and again, these were established by the Citizen CPR Foundation, a process has been put into place for the collection, analysis, and use of cardiac arrest data to measure performance. So here they're recommending the CARES registry as far as entering information into the CARES registry. And we have some recommended activities in this area as well. And then I will, Tim, please, if you have anything additional to add to this. One of the questions that we kind of had when we started looking at community element number 2 and regarding the CARES registry is that the state has really been talking to local health departments about talking to their EMS about being a part of the CARES registry, but our local EMS submit this information to the Department of Health. And so we've had a lot of conversations about, why is it not just automatically being put in there? And so I know that this is something that Tim and Scott were reaching out to both IDOH and the Department of Homeland Security about. So that's where we come up with these recommended activities to contact the Indiana Department of Homeland Security. Moses is with IDOH, who works with the CARES registry and doing that integration. Having a CARES registry presentation from IDOH to all of our EMS providers. Porter County EMS enrolling and participating in the CARES registry. And just making sure, because the health department personnel are going to be the ones, because we also have a requirement to share our data publicly and let the public know where we're at, making us aware of how to obtain that data and having an agreement about how that's going to be shared publicly, because we want to make sure that that's a community team decision. So for this, the work group representation would be someone from each EMS provider in the county. So that would be Valpo, Portage, Northwest Health, South Haven, Lake of the Four Seasons, and InHealth. And Tim and Scott from Valpo Fire Department have agreed to begin leading that work group. Tim, do you have anything else to say on that?
Yeah, Carrie, can you hear me?
Yes.
So for those of you that are EMS-based organizations in the meeting, Scott did reach out to IDHS. We're waiting to hear back from them on guidance because it sounds like there's a disconnect between the EMS reporting and the Department of Health at the state level between the two. So we're waiting to hear back for guidance on that and how we're going to implement this. But we will need everyone that provides EMS services in the county to register and provide this information. We just don't know where we're at yet. So I know I saw Dale on the call, I believe. So we'll be getting a hold of each of you to set up a meeting.
Yeah, Tim, Moses did a presentation to the trauma group, the the intact group this morning, and he mentioned that the information did flow into NIMSA, so maybe there is a way, or they're working on a way for that.
Okay, thanks, Dale. We'll be in touch.
Wonderful. Dale, I know Tim's going to be in touch with all of you. I'm going to throw you in this work group. Is that okay?
Yes, that's fine.
Anybody else on the call from any of the other jurisdictions? I know you'll find them anyway, right, Tim?
Yes.
I'm here. Jess is here from Northwest Health as well.
Thank you.
Mm-hmm.
Thank you both for being on today, Dale and Jess. Jess, if I spelled that wrong, I'll fix it, I promise.
That's correct, actually.
Okay. Does anybody have anything else to add to this? Tim or anybody else as far as recommended activities, things I'm missing? We appreciate you guys for having this. Right, we're going to move on to 3. Okay, community element number 3, train citizen rescuers. So this is a big lift because the goal is for 15% of the county population to receive CPR training annually. So with our population, that's roughly 26,000 people. And this can be hands-only CPR. And we've talked about a lot of different models for this. There are some videos that are approved that are 30-second to 60-second videos that can be shown with hands-on instruction offered. So it can be done kind of in like a large group setting and things like this. So right now what we're looking to do is put together a group who will come up with all the different methods for hitting that 26,000 person number each year. And those recommended activities have been identified as identifying the training taking place that has not been recorded. We've recorded a lot of it amongst our team. Thank you. Identifying areas of the county with gaps in training delivery. So getting out there and doing outreach to those who may not live, right in Portage or right in Valpo or right in Chesterton, and may not have, be getting out to go to some of these events. Determining a plan for addressing training gaps. That's what we just talked about. Identifying appropriate training tools and providers. Also making sure that we include ongoing training. So places, businesses, other public locations where there is an AED, they've had it for years, making sure that there's a plan in place to have, updated refresher training for all the employees, that there's a program in place to ensure that when a new employee starts, they get that training so that we aren't missing out on that, an AED that's in a place where maybe people don't know how to use it. So identifying the costs and additional funding opportunities, identifying host sites, identifying and activating promotional partners. Anything else to add to these activities that this work group might need when they are working on getting us a model for training 26,000 people a year?
My suggestion might be that we use some type of QR code registry to, and particularly don't forget like the hands-only CPR people when they get that training and stuff like that. That's an easy way to reach a lot of people.
Great. And then I did just see from Cliffs, they had asked about partnering with Northwest Indiana American Heart Association. So that's something that we'll definitely have to see about reaching out. I actually had, I saw that you guys have a hands-only CPR training kiosk. That's amazing. I saw it at Midway Airport and had reached out about, seeing how much those cost. And they are quite pricey, but that's awesome that you guys have one of those. And I believe it was it your insurance carrier that you guys were able to get some sponsorship from for that?
I believe it was, I can't be 100% certain, but I believe we received it at a limited cost, or like a rental, kind of using it. I think it might be owned by the American Heart Association. It is currently still on site, but my understanding is they are going to be moving it to another location. So that might be something we want to reach out to the American Heart Association with, to see if maybe we can, use it for a period of time. They could station it somewhere at maybe a minimal cost for a community benefit. Also at Cliffs, we do have a foundation, so we could, if Porter County would like to put in a grant request for any funding, I can certainly provide that information. That would be an opportunity to raise some funds to be able to do some of the community activities you're interested in. So,
Thank you. Is it okay that I'm typing this in here?
absolutely.
Anybody have anything else to add here? Tara, our clinical outreach specialist from the Porter County Health Department, has agreed to lead this work group. She actually came to us as an AmeriCorps HeartCorps employee last year, and we were able to retain her as a full-time employee at the health department. They actually do not, it's Rural at Heart, is that what it's called now? It's not AmeriCorps anymore, but they maintain HeartCorps through the American Heart Association and renamed it. But Tara is a whiz at outreach, and she herself did, I believe, almost 300 hands-only trainings this year. And so she's looking for a work group to work with her on this. So who would like to volunteer to be on this work group?
Carrie, this is Brianna from the Portage YMCA. I can help with that as well.
Thank you, Brianna.
This is Joy Sunday with Valpo Schools. I can help with that.
Thank you, Joy. Anybody else want to put their name in for this work group? We will be reaching out to others because, of course, we have a lot of people who couldn't be on the call today.
Carrie, I'll help her too. It's Jamie.
Thanks, Jamie.
Mm-hmm.
Yeah, I could be on that committee as well.
Okay, thank you.
It's Caroline Martin, just so you know. It says C. Thomas, but it's Caroline Martin.
I knew it was a different last name, and I'm like looking through my list. I'm sorry. Thank you, Caroline. Thank you guys so much. Anybody else before we move on to the next element? All right. HeartSafe community element number 4, recognize and celebrate the actions of rescuers. So the goal here is a formal recognition process in place for the celebration of life-saving efforts. So here, all first responder agencies first have to know about the recognition and celebration efforts plan. So of course, we know that all of our first responders have a process for which that they celebrate those who respond. And when citizen responders respond as well. But as far as wanting to have a really consistent way that this is done, we have to first let everybody know, that we're doing this, right? And so we'll have to let them know that anytime anybody engages in life-saving efforts, this information is going to need to be submitted to the lead agencies for HeartSafe Porter County. It's listed here, a press release to all media outlets. So hopefully it will get carried by several of the media outlets as far as our papers, their online sources, even radio, and formal recognition by the Porter County Board of Health. And so we kind of thought that, the Board of Health is for the whole county. And so this could be recognition that we know can happen for each and every response. And so that is what we came up with 4 activities here. Does anybody have anything else to add to this? For this, it was indicated that maybe public information officers from different organizations within the community team might be the best at this. They could kind of come up with one set press release, one notification for all of our social media, because hopefully when something like this happens, we will all put it out on all of our organizations' notification channels as well. So they'll kind of come up with that as well. They'll come up with the process for notifying the Board of Health and getting that on the agenda, things like that. So we had identified PIOs from different team organizations for this work group. Any feedback for that, or anybody want to throw out their PIO's name?
I can help with that, and then I can connect with Ben, our public information officer here at the sheriff's office.
Thank you, Faith. Or Ellen, sorry. I get for looking at the chat and typing.
Hi, this is Tim Richardson. If you can hear me, I can assist on that group as well.
Thank you. Anybody else for this group?
You can put down Bob Schulte for Valpo Fire.
Am I even close?
SCHULTE.
Anybody else for here?
I'll talk to Kim Raniger from the mayor's or from the city. I wouldn't put her down just yet, but I'll talk to her and I'll let you know.
Okay. Put that here, okay. Thank you, guys. Anything else for recommended activities? All right. Element number 5, educate citizens on how to respond to sudden cardiac arrest. So this goal is a public awareness campaign plan established and sustained throughout the year using a combination of tactics. So for recommended activities, the Porter County Suicide Prevention Task Force is actually working on funding for mobile billboard advertising. I believe that they're very close, and it actually can show videos. And so we were kind of thinking as far as those informational videos we were discussing about, any of our awareness campaigns that we want to get out there. I have heard that Lamar will partner with nonprofits to do public awareness campaigns, possibly working with parks and other municipal departments for advertising ahead of big events that they have. We're thinking like movies in the park, those kinds of things. Developing consistent social media campaigns that we all can then promote, press releases, radio messaging, consistent awareness by all team members and partners. Does anybody have any other activities to suggest for this? Anything that wasn't thought of here, or anything to supplement or add to any of the current recommended activities?
I have a question.
Yes.
Is there funding for all of this advertising?
So that would be part of, once these activities are decided upon, if some of them require funding, then that would also be part of then looking into funding for that.
Okay.
Part of the work group activities. Want me to put that down here, Carrie?
Yes.
Yep. Anybody else, anything to add up here? For that, I don't know. I do not know why Google does this. I'm sorry, jumping all
Carrie?
around on me. Yes.
So I think also one thing that might go on a note too is the American Heart Association, I do believe can provide funding for educational resources. They are another consideration besides the Cliffs Foundation that I'm aware of to
Okay.
make funding for educational purposes, because that is part of their goal. So.
Thank you. So for this element, Carrie Honeycutt from the health department and Teresa Mago from the Zach Mago Foundation have agreed to help to lead this. So Carrie has done a lot of similar things with the Suicide Prevention Task Force as well, and has a lot of connections within our community as the care coordinator of the health department. And Teresa, through her foundation, a lot of contacts in the area of heart health and in the prevention and promotion area for sudden cardiac arrest. So if anybody would like to join them in their work group, and of course we will.
Demetrius Lewis here. I'll hang out with Carrie Honeycutt and Teresa Mago.
Thank you, Demetrius.
This is Tara. I'll help them out too.
Didn't do it wrong, Tara. E before L.
It's LE.
Every time. Anybody else for this work group besides the people we're going to volunteer? All right. Anything else to add here? We will move on to element number 6. Train emergency communication center staff in telephone guided CPR and the use of AEDs. So the goal here is telephone guided CPR in accordance with American Heart Association recommendations is in place. If not in place, formal efforts at implementation have been made for regulatory reform and policy change. So when we did our community assessment, we had this at a 5. Debbie and Rich both let us know that they are all formally trained and up to date per the AHA recommendations. I believe you guys maybe even said that in Indiana there is policy in place. And this is very exciting because when we met with the Citizen CPR Foundation, they actually expressed that this is one of the hardest elements for a lot of places. And of course, they're nationwide. But they said that there are a lot of places that really struggle with this because it does require policy change. And that's sometimes a really hard lift. So this is not one that right now we need to do anything about. We just need to make sure that there's a method in place for continuous evaluation and continuous quality improvement as guidelines and recommendations change and as telephone CPR is guided as it's administered through their guidance. Does anybody have anything they want to add or say here? Okay, we'll move on to 7. Community element number 7, plan for and practice responding to sudden cardiac arrest. So the goal here is an emergency action or emergency response plan in place for all schools, municipal buildings, businesses, and public venues that are tested through simulations or drills at least on an annual basis. So for recommended activities here, we have identify schools, municipal buildings, businesses, and public venues for Project Adam designation. Identify lead Project Adam individual for each location. Pair an individual with the site with current Project Adam status to work toward element for designation. So pairing the lead individual from a site working to achieve status with someone who already has. Ensuring the entire HEARTSafe team to celebrate and advertise Project Adam designations. So again, we'll kind of work with the group, with the PIOs to come up with something for celebrating these designations in a really consistent manner. So for here, the thought is that the work group would be representations from schools, municipalities, and businesses. And Crystal from the health department has agreed to lead this, thinking of a school and or a business co-lead, if anyone would be up for that.
This is Joy Sunday. I'm probably a better fit for this group. I don't know that I want to be co-lead, but more than happy to be on the committee.
Okay. All right, Joy, and I will move you to this.
Hi, it's Dee Dee from Ivy Tech. I'd like to be on this work group as well. I don't know about a co-lead, but I'd be willing to participate.
And you know, I was thinking that we could reach out to somebody from Duneland or Portage. All their schools have the HEARTSafe status, so maybe they would agree to co-lead with Crystal. I don't know. Is there anybody on from Duneland or Portage schools?
Hey, Carrie, this is Brittany Smith from Chesterton High School. I can help with this.
Do you mind being co-lead with Crystal?
Sure, that's no problem.
Thank you.
Yeah, and this is Darlene from Ivy Tech. I would like to be on this as well.
I'm sorry. Thank you. I got you. I started typing and then I stopped.
And Nate from Bee Nutty Peanut Butter, either Carol or I will be on this with this work group as well.
Barry, add Chuck Garber to this one, please.
And I will fix this all up, guys. Get names correct and full names and all of that. Anybody else and or any activities to add to this? This makes me really excited because I was thinking this was going to be a lot of work because there's a lot of places, but you guys seem very excited and that makes me excited.
This is Elise from the BELPOY. We could help as far as you know, maybe testing with simulations, or we have a pretty robust emergency action plan set up if we wanted to be you know, kind of give input as to that too. I could help with that.
That kind of what you were thinking, Elise?
Yeah, we could do that.
Okay. Love it. Thank you. Anything else for this? Recommended activities? Any other for work groups? Okay. Community element number 8, strategically placed 24/7 accessible AEDs. So the goal here is AEDs are strategically placed in public locations where cardiac arrest is likelier to occur, and 24/7 accessibility to AEDs is enabled whenever possible. So for recommended activities, what was put onto this sheet was identify areas of the county with gaps, so those public locations with gaps in 24/7 accessible AEDs, determine a plan for implementing additional 24/7 AEDs. So this includes specifying target locations, cost and funding opportunities, potential funding partners, including a plan for training employees or those regularly in attendance in those locations. Does anybody have any other activities for this one? So for this, Tyler McLeod and Dan McGuire from Chesterton and Valpo Parks have agreed to lead this group. And so, of course, anybody's welcome to be in any work group, guys. So please know that you're not excluded from any of them. But here the thought was maybe participation from our municipal parks departments and other event locations, as far as just kind of having that information and kind of getting those into those places. But again, anybody can be a part of any work group. If anybody's on the call who.
Carrie, can you go ahead and add me on also, Chris Contrino?
Yes.
Thank you.
Thank you, Chris.
I can help with the cost aspect of it.
Thank you, Teresa. That's always amazing.
This is Crystal. I will help as well.
Jeff, not to put you on the spot, did you want to be in here too? Anybody else or any other activities for this work group? Okay.
Carrie, you could probably go ahead and toss me in on that. I can help as I can.
Oh, you decided you wanted to. Okay.
Yeah, I was trying to get the microphone to work and it wasn't cooperating.
I was like, oh, Jeff says no.
Carrie, I'm pretty sure I'm going to be a part of that too, so you might as well throw my name on it.
Right, thank you, guys. All right, number 9. All right, HeartSafe community element number 9, establish a 911 integrated AED registry. So the goal is to establish a 911 integrated AED registry and a way to easily find and add new and unlisted AEDs. So we've kind of got 2 parts going on here for recommended activities. And the first is, so Pulse Point is one of these registries. They have a couple that they recommend. And Pulse Point has a Pulse Point AED that is a free app that AED, municipalities can go, they can enter in AEDs. Actually, anybody can enter in an AED, but there has to be somebody who is approved to register them. So they actually have to go make sure that, they've been tested, that they're not expired, batteries and pads are all good. They are where they say they are. They have to verify them and get them on there. And then anybody with the app who is in the area, if an emergency were to come through and there were to be an arrest, would be notified that there was an arrest near them. This is where the closest AED is. So there's that, the Pulse Point AED. And then there's also a paid version that's Pulse Point Responder that actually integrates into our dispatch system, and that's calls, I believe, go out through that. So I am going to throw to Chris Contrino to give us a little bit of good news, because on our original call last month, we talked about the Pulse Point Responder has an implementation cost, and then there's also an annual subscription cost. And we had applied for a community foundation grant for the implementation of Pulse Point Responder. So I'm going to let Chris give you all some news about that.
Okay. Yes, we did find out last week that we did get approved. And we will get the $10,000 from the Porter County Community Foundation to pay for the implementation. Yay! Yay!
So that is really exciting. And then Tim is going to give us some news about that first year of subscription funding.
So I spoke with the fire chief a couple hours ago, and Valparaiso Fire Department is going to fund the first year of the subscription funding for Porter County Pulse Point Responder app.
That's awesome. Thank you.
And Tim, can you explain a little bit better than I did how the Responder app is different than the AED app and how that integrates into our call system?
Sure. So the Pulse Point AED app is a free app that people can register their AEDs, but the Pulse Point Responder app actually has two sides. It's got the citizen responder, which is anybody that signs up for it. So if there's a 911 call and they're in the area, it will alert them that there's a full arrest in the area, and they can respond to that as somebody who's close by. And then there's the first responder app, which actually goes to all the first responders, and Pulse Point actually already has an API established with Motorola for our P1 CAD to basically work within the CAD, and it automatically sends out those alerts to the first responders that are going to the calls. So it's kind of two different apps in one. And then you can set up, so if somebody was from like Washington State visiting here at the university, and there was a full arrest at the university, and they had the Pulse Point app, and we allow people from outside, whether they're citizens or first responders, they could receive those alerts as long as they're within a certain area of the incident.
Awesome. Thank you. So for this work group, we'll skip down to line 10, determining the funding sustainability. So beyond the first year of funding, so around about the beginning of 2027, then it will have to be shared funding responsibility for that continued subscription. So this group will be talking about that, determining that information, as well as Tim is currently working with Pulse Point to get the registration authorization, but there actually has to be a method for authorization, and that's going to have to be shared responsibility as well, because we will have so many in so many different municipalities, as well as establishing a method for the promotion of the app and the location addition. So that is what we're looking at for activities. What activities do we need to add here?
So we're just waiting for Craig. He's getting ready for EMS World Conference next week, which is a huge conference for the EMS world, basically. But won't be till the week after next that we'll be able to start meeting on all of this.
Perfect. And I did talk to Debbie and Rich today via email, and they are all in to be in this work group. Valpo Fire has agreed to begin the registration and to begin the lead on that. And so we will just kind of like with element number 2, right, Tim, be reaching out to our other responder locations.
Yeah, and I talked with Scott. He could just put me down as the lead.
Okay. Oops, there are too many eyes in there.
Periods, Chuck, put me in as a participant, but one of these two I'm going to give to one of my officers, but I want to talk to him first.
Perfect. Thank you. And that's a good point. That was one of the things I was emailing with somebody else about today, If your organization is going to be in 2 different work groups, or you feel that you're suited for 2 different work groups, we can add other people from the organization into the community team, or even just as your representation from the work group, however you want to do that. So please, thank you, Chuck, for that. All right, anybody else that wants their name put down here? Or Tim Voluntelja? All right, we're going to move on to number 10. All right, HEARTSafe community element number 10, equip first responders with AEDs and teach them how to use and maintain them. So the goal is first responder agencies are trained and defibrillation capable and have put in place device maintenance plans, dispatch policies, event debriefing, and medical direction, period. Sorry, I thought there was a comma there. And medical direction. So for recommended activities for here, identify any gaps in first responder AEDs. And so mostly we'll be looking at PD, because we know that all of our fire departments and our EMS have them in their responder vehicles. So mostly we're talking about our police departments. Determining a plan for adding first responder AEDs, identifying costs and funding opportunities, identifying and activating promotional partners, assessing and ensuring proper training. Any activities to add to this element? So again, for this work group, we're looking for representation from police departments. Perfect. And Mark Lamont from Valpo PD has agreed to lead up this work group. And I know I've seen comments in the chat. We have several police departments with AEDs in all of their patrol cars, which is awesome. Like, we really are getting there. And I know with Valpo PD, they just got some additional funding as well, and they're adding more. So we are looking. Teresa has asked a question. What type of AEDs do we have in patrol cars? Are they all different?
For Valparaiso, we use Philips HeartStart. That's the one brand. There's 2 different models that are out right now, but that is the one brand and model that we're using.
Okay. Chesterton says they just purchased the same ones their local EMS utilizes, and they've told us that before, Teresa, but I can find that out.
Carrie, this is a side note, and I'm sorry I had to take a call for like the last 30 minutes, so I had to step away.
Oh, sorry, Ellen.
No, you're okay. I just feel bad that I had to, juggle 2 things. But so I have a list of all of our patrol vehicles that have an AED, as well as things like our SWAT bus, and like, things of that nature.
Yeah.
I don't know if dispatch has that or not. And I didn't see a good place to input it into our current documentation, so I didn't know what the best place to put that information would be.
Yeah, if you want to, and I can send you an email too, Ellen, but if you want to email me and copy Crystal, or just if you have mine and you want to email it, if you don't mind emailing it to me, and I can get it to Crystal, and we are sharing all this with Debbie and Rich, so then they will have that as well.
Yep, I'll send you an email.
Perfect. All right, and then Teresa, Chuck's going to let us know about the Valpo VUPD and what brand they have in their trucks, or in their cars, I'm sorry. Anybody else have any information on AED brand? Or volunteer for this work group before they wrangle you? And remembering too, those groups that have the AEDs in all of their cars, it's going to be very helpful to be part of this work group to help those who maybe don't with secrets for funding or what they did to promote their need and things like that. Does everybody see the note from Teresa in the chat? And I know I haven't been great about the chat, guys. We will go back and review them all. She says, if you're using Zoll, Cardiac Science, or Defib Tech, the Zach Mago Foundation will pass along the discount they get for AEDs, pads, and replacement batteries. Teresa, the quote, I do have the most recent quote in the links that I've been sharing, but I'm trying to remember, is it only Zoll that's represented on that sheet?
No, Defib Tech is also.
Defib Tech's on there as well. Okay.
Well, it depends on the sheet you have.
It was the most recent one that we got.
Okay, I'll make sure that you have.
Okay.
Have their
Perfect. So then that's a link that we've been sharing out. It also has the Save Heart cabinets on it.
Yep.
With that discount that the foundation passes along to us. And then also this week I added, and I will send out to the appropriate groups and anybody that wants it. Save Heart has a non-powered cabinet. They're working on solar. It's about a year out or so, but they have a non-powered cabinet, and he sent me quotes on that. So I have that in the drive as well. So I will send that out to not only the group that's working on the AEDs, but also anybody who would be interested in that. All right. If anybody has anything else, let me know. Otherwise, I will go to element 11. And that is train EMS clinicians in high performance CPR and resuscitation. So the goal, EMS providers practice high performance CPR and maintain protocols, technology, and equipment that support effective, high quality resuscitation and post resuscitation care. So this, when we did our community assessment, was at a 5.0. This is something that we are already doing here in Porter County across all of our EMS providers, which is amazing. So for having that 5, we will just need to make sure that as we move through and achieve 5 on all of them, as with everything, we have a plan for continuing to evaluate that, making continuous quality improvement and sustaining that 5. So right now we will not place a work group in that area unless somebody thinks otherwise. And Joy put some information in there about AEDs that were provided for the Valparaiso or for the Valpo High School or Valpo Schools athletic department, and may also be able to give group discounts and be active in the group. So that's somebody else that we will reach out to. His contact information is in there. Thank you, Joy. Okay, so community element number 12, establish a process for quality improvement and annual public reporting of cardiac arrest data. So the goal here is a process has been established for continuing quality improvement and public reporting of cardiac arrest data on an annual basis. So for recommended activities, determine current continuous quality improvement activities currently occurring. Sorry, I need to fix that. But I believe, Dale, is this the group that you run with all the EMS providers? And I can talk to Dale separately about that. So I believe this is something that's already taking place amongst all of our EMS providers with Northwest Health's EMS group through Dale and Jessica. And so the health department will actually collect the data.
Can you hear me?
And oh, yes.
Oh, sorry. I guess I have 2 mute buttons and I had one unpushed. I'm talking to you.
No, sorry.
That's okay. All of the EMS agencies, that are in Porter County have some type of continuous quality improvement process through their medical direction or internally. That's a
Okay.
requirement of the state EMS rules. I interact with a lot of them, but I'm not over or involving all of them, but be more than happy to help with that.
Thank you. Would you mind being on this work group with Matt and I, just as far as directing us kind of how to get involved, make sure that we're collecting the right information. We just want to make sure that we're in a group where we are able to, make a shared decision together as far as what it looks like, what we're putting out there that's going to be community facing versus the information that we gather.
Yeah, I'd be happy to.
Thank you. And then Dale, do you run the group for Northwest Health's EMS currently?
Yeah, I do the audit reviews and things like that. One of the things we have, and we're working on some technology changes and stuff in the area, but we have different types of software that different agencies are using to document their EMS responses, and it's difficult to gather some of that data. But if we can, with the CARES program, that's a possibility that some of that will get merged so we can get that information and have some better response with that.
Perfect. Yeah, I think that is why they encourage that, is for that purpose. And then and if you are part of CARES, I believe that's all community facing. So it could even be a method of, sharing that link out, and then also maybe providing some dashboards that make it a little bit easier for people to digest. So does anybody have anything else to add to this or want to help and be a part of this work group? Okay, we're in the home stretch. We're almost to element number 13. All right, HEARTSafe community element number 13, develop meaningful health promotion and prevention measures for sudden cardiac arrest. So the goal is that meaningful primary and secondary health promotions are tailored to the needs of the community and are in place. So for recommended activities here, kind of the same as with the training AED locations, we're going to identify areas with gaps in promotion and prevention programming, determine a plan for addressing the gaps, identify appropriate prevention and promotion programming and providers, identify cost and funding opportunities where needed, establish host sites, outreach opportunities, and identify and activate promotional partners. Anybody else have any other recommended activities for this? Suggestions for any of these? So for this work group, Carrie Higgins of our Tobacco Coalition for Porter County and Christy Cleveland with Powers Health, stationed in the Valparaiso YMCA, have agreed to be the leads on this work group. In here, the work group ideas are those who have primary and secondary prevention programming for sudden cardiac arrest, so YMCAs, hospital groups, our Tobacco Coalition, our health department, together with the Zach Mago Foundation. We do the youth cardiac screenings.
You can put me in this group, Carrie. Elise from the LPY.
Thank you, Elise.
Carrie, will you also put Portage YMCA? I don't know if it'll be myself or if I'm going to have one of my team do it, but for sure we'll have somebody on here.
Thank you.
Carrie, this is Shannon Hurst. Can work with Christy as well.
Okay, perfect.
And Carrie, I can make sure I share it out with our coalition and see if any of our coalition members would also like to be engaged in this effort too. So I'm hoping we can get 1 or 2 to participate.
It's amazing. Thank you.
You automatically have 1, Carrie.
Nice, Shannon.
Awesome. Yeah, and the great thing about these work groups are, now you guys are going to have an opportunity to work within your work groups. And so that can be whatever works best. So I've had a couple people email me, and these meeting times haven't been great for them. And it is really hard, right? When we have a big group, honestly, our email list is almost 100 people. We have a lot closer to half that or a little bit less on the meetings, but it's so hard. It's impossible to find a time to get everybody together, right? But when you have these smaller targeted groups and you're meeting, you can decide the best time for you. You can have discussions virtually and then divide out duties, and then you can communicate via email. So it's going to look different for every single group when you work in chunks of a quarter of a year, and then we have that report out and reassessment, then you really get time to gain momentum toward these activities. And you guys might decide to add or delete activities as you're in your work groups. We're basically just trying to work toward that goal and hit that assessment of the 5 and have a plan in place for being able to sustain that for our HEARTSafe status and for the heart health of our community. So that's kind of where we're going with that. Anything else for this element? Anybody else for this work group? Does anybody have any questions before we wrap up? Questions, comments, please, anybody from the leadership team or otherwise, something that I forgot.
Carrie, there's a couple people in the chat asking to be added to this work group.
I see that. Wendy, thank you so much. And Rachel. Okay, I'm going to real quick go up to the top of the chat. I want to make sure that we addressed everything in the chat. Please make sure if somebody was not available, if you do not have access to the chat and you weren't available, shoot me an email and let me know you were here. I don't want to miss anybody. I will save the chat and get it and the recording of the meeting today sent out to everyone tomorrow in the follow-up email. And then tomorrow and Friday, start dividing up and sending out individual work group emails so that within your work group, you have the name of the leaders, everyone who signed up within the work group, everybody's contact information, the element, the goal, the recommended activities, as well as any suggestions anybody made today. And then that email will also contain links to any resources that you might need for your specific element. Please remember, though, that any other resources that you need, that gosh, I think somebody mentioned that, or we just really need help finding this, reach out to us. That's what we're here for, to make sure that we get you that information. This is from Caroline about the Northwest Indiana American Heart Association, so we'll be in touch with them. Tim recommended adding increasing public awareness to the mission. I apologize, I missed that completely.
And Carrie, also Jessica asked to be added to that work group.
Okay. The work group number 13.
I assume so. She said the last work group.
Thank you. Perfect. Thank you, Jessica. Crystal put in there information. Okay, so I did write down information about the Cleveland Cliffs Foundation grant. If there are any other grant opportunities, Chris is the grants and contract specialist for the health department. She would be able to write for any of those for funding for AEDs, for advertisements, so if anybody knows of any other grant opportunities, you can send those to Chris. And then as far as work groups, she can work with work groups on some of those funding opportunities, depending on what the request for proposal is. So Chris's email is in the chat. And again, I will send this out. We will add Allie to a work group. Chesterton did respond about their AED type. Physio Control Life Pack 1000s is what Chesterton has in both the PD and the EMS vehicles. And then we're going to put Jessica in this work group as well. Anyone else? Questions, comments, concerns? So once the follow-up gets sent out and then work group emails go out, we will be asking that everybody begins working in their work group as soon as possible. Again, those quarterly work group check-in meetings, those will begin in January of 2026. So we kind of give everybody a few months to work in their work group before we have the first check-in. The idea is that those will be in person, that there will be snacks and some networking time. For those of you who go to CRN, we're kind of thinking a little bit like that. Some snacks at the very beginning, some networking time. Not that they have snacks. I'm sorry, Ellen, don't tell. Don't tell Sam that I was suggesting she needed to. And then kind of get started and keep them right at that hour as much as can be done. And there will also be a virtual option for those, because we know not everybody's able to make it in person, but it's just a really good idea for us to all connect together, have something to draw people to the meeting, be able to get some FaceTime for each other. So that first January meeting, and I'm saying this from North Carolina, but we'll be at the health department, I'm thinking, in 102A, in the Porter County Government Conference Room down there by the health department. Now, the next one we will have to be looking for another place to hold, because they will be having primary elections in there and we get booted out of there pretty soon, followed by the general election in November. But for that first one, we can have it there, and then maybe go to the community foundation, or if somebody else has another space they can offer up, then we can do that. Maybe one of the Ys, or we can kind of move around the county to make it convenient for everybody. And we'll start having those check-in meetings and reassessments with those. And maybe if that first one, set a goal for when we think that we can hit 5 for all of our elements, and begin working on an assessment with the Citizen CPR Foundation. Does anybody have anything else? Questions, comments, contribute to the meeting?
Hey, hi Carrie, this is Tara. I just wanted to say, if you're not in work group for the element 3 and you are a CPR instructor or teach like any type of CPR at your facility, if you can please send me your numbers so I don't have to track you down, that would be super helpful. Thank you.
I am going to put Tara's email right below her name right there.
And also, we do have 2 sessions of hands-only CPR at the health department tomorrow, 10 a.m. and 2 p.m. If anyone wants to sign up, it's on our social media. It's free, so, or share it with anyone else at your facilities.
Yes, tomorrow is National Restart a Heart Day. Does anybody else have anything going on for National Restart a Heart Day that you would like to promote?
We will be teaching CPR and how to use an AED at our heart screening tomorrow evening.
Awesome. Yes, thank you. And if anybody is willing to share out those two, I'm sure that you could go on to either social media page for the Zach Mago Foundation or the Porter County Health Department and share those out. We would love that. Oh, and Christy says she's doing an AFib screening at the Valpo Y tomorrow. Anybody else, anything to share for promotion or otherwise?
I just wanted to say that the Tobacco Coalition, we will be observing, like everyone else, with the American Cancer Society, the Great American Smokeout on November 20th. So if any organizations would like assistance promoting the Great American Smokeout, it's a great day to quit. We would love to help you. So if anyone wants to do something for their employees and or their clients, patients, we would be happy to help you out.
Thank you. All right. Anything else from anybody else? I really appreciate you guys so much today and all your time. Bearing with me and my not very technologically savviness. All right, well, you can expect an email from me tomorrow. If you have any questions that you just forgot to ask or didn't ask, want to ask in front of everybody, email anytime. Call me. My cell phone number is down at the bottom of my signature line as well. Anything that you need, if this is your first time to the meeting and you have any questions because you weren't at the first one, do not hesitate to reach out. And again, if there's somebody else, that you think would really benefit from being on here, that we would benefit, and you just don't want to put their name out there in the chat, I totally understand. Reach out to me. We can make a plan for contacting them and getting them involved. So I appreciate you all. And I just hope that you have an amazing rest of your day and an amazing rest of your week. And a great National Restart Heart Day tomorrow.
Thanks, Carrie.
Thank you.
Thank you.